site inspection for infection, remote transfer to cardiac. Be prepared to know how to do cardiac. It's simple. Cardiac is inspection, vitals, starting with the heart sounds, 5 heart sounds, checking edema, and checking pulses. So you know cardiac. You do cardiac every day in clinical. You do it in co-op. You know GIGU. You do it every day in clinical and possibly in co-op as well. These are no-brainer assessments for you guys. You should just roll. And it's smooth. We're not getting into like the sophisticated things that you might have learned in 112 years back. It's very basic. They're focused exams. And for central line, yes, because it's near the heart indirectly, you could say it's related. The real deal here is I want to check the site for infection, right? It makes sense, okay? So in doing that, I'm going to look at this site. If I want to touch, I can touch now. Don't touch after you take the dressing off. I need clean gloves to take the dressing off. I need a mask to take the dressing off. The mask is in the kit. I can't use that mask. I need a different one. Don't wait to put the mask on. You're exposing the patient. The patient should have a mask. The patient should have their head turned. So we're going to pretend that I've got my mask on. Okay? I just got his mask. All right, get your kit. Now, I would have a table, and I would have my table set right here. Right? For today, so you can see me, I'm just going to pretend that my table's there, because Professor Persian has a table. And we're going to pretend that that's our table, so you can see me. Okay? So with that in mind, check the kit, check the expiration. Same thing we did with the NG kit. Check the integrity. From there, I'm looking to see what's in it. It's latex free, which is good. You want to make sure it's not latex allergy. Open the kit. Should be waist high. We're going to pretend it is. Now this kit, you guys got kits. You can use your kits. If you have your old kits at home, you can use them. And you can practice with kits up here. Just try to keep them complete if you're practicing with them up here. Because you use your kit to mimic what you're going to use in checkout. Okay? So the way to straighten this out here, this way. And this I can work with. This mask I'm not going to use. There's a lot of waste that goes on in this kit. I'm going to introduce the bio patch. You have fake bio patches that you can introduce to your kit so that they're sterile. It's a drop. From there, I need the gloves. So I'm going to reach in, just take the gloves, don't touch anything else. I'm going to put the gloves on, and it would be on the end of my table, not on the patient's pelvis as you're seeing right now. Doing the best I can with the limited space here. Sterile gloving, we're checking you out probably 3 times on sterile gloving. Foley, central line, and trach care. Now these gloves always are stuck together. Sometimes the way to troubleshoot it is just to start to put it on, and it will work for you. If not, bring your own sterile gloves. You can use them if you don't like the gloves that are in the kit. So this is going to work for me. And the gloves should be their palm up, right? From here, the only thing I'm going to use from this kit is the bio patch, Floor Prep, clear adhesive dressing. Pop this. What did I forget to do? So what would happen in this scenario? We'd have to start all over. Take the dressing.
So it's clean gloves, take dressing off, dump it, change to sterile gloves.
Yeah, exactly.
Okay.
But you all let me do it. See, because I'm trying to be fast. Get so that you get to practice. So, in recap. Yeah, and she's rolling it just and she's starting it. And as she's taking it off, she's taking it all off from the outer edges to the center. She's got her clean gloves on. That's a girl. Keep pulling. All the way around. Good. Good job. Perfect. And that goes right in her dirty gloves. She can continue to look at the site, and I'm coming in sterile now. Everybody got it? Okay. If that happens to you in real world for our checkout purposes, if you told me that, that would be acceptable. As long as you taught yourself. So what you would need to do. Scrub, scrub, scrub 30 seconds vigorously. Now ChloraPrep, I don't know if you know it, but chlorhexidine has alcohol and ChloraPrep in it. And so chlorhexidine says that you scrub for 30 seconds, backward and forward motions, no concentric circles. So 30 second scrub, happy birthday twice, and then release. This goes over here, trash. Checkout purposes, we're not gonna have you engage the lollipop, it takes too long to dry. But in real world, you engage the lollipop, you scrub for 30 seconds, you allow it to dry, and then you proceed to put your bio patch on, okay? So the bio patch is blue sky, blue to the sky. That's the way you put it on. Your fake bio patches have the cardboard so that they don't actually fold well for you. But in real life, the bio patch folds like this, so it has a little bit of a split. So when you go to put it on, and it envelops. You see how it just seals around there. The split direction should go in the direction the line's coming out. So when you took it off, if you notice, it came off as a unit. If I had twisted it around like this, put the gauze on, put the Tegaderm on, you see how it would be sandwiched and it wouldn't come off. So that's a key thing. And you're gonna learn that in practice, because if you don't wanna have dirty fingers down at the site trying to separate gauze from sponge, okay? So it should go in the direction. This hand's the committed hand, this hand's still the cleanest of the hands. This part now is gonna be to put this on from the center out. Get good seal, no air pockets. This line is not placed anatomically correct. We would never place a line on a nipple. So we're just gonna pretend that that doesn't exist. You know, the line should be much higher, like right there. I'm not sure why the line's down there, but anyway. Okay. Now I can take this and put my date and time on it, and it's dressed. So I'm gonna note the characteristics of the site. I'm gonna note how the patient tolerated the procedure, and date and time.